Hi, I am Olokesh. We are here with Dr. Adil Hassan. We are here with him to know about the kidney cancer.
Right. Hi, I'm Dr. Adil Hassan. I'm a consultant in medical oncology, and today I'll be answering a few of Mr. Alogesh's questions regarding kidney cancer. Please continue, Mr. Alogesh.
Doctor, how common is kidney cancer and at what age group is the generally age?
Kidney cancer is one of the top 10 types of cancer which is seen worldwide. It is generally seen in the age group of 60s and 70s in the West. But in Indian literature, we are seeing patients at a much earlier age group, that is around 30s, 40s, and even 50s.
So, is it more common in man or woman?
The literature does say that it is more common in male compared to the female. In the Western literature, as I said, it is twice as common in male, but the Indian data is a little different. It may be as high as 4 times more common in male when compared to females.
So, what is the risk factors of the kidney cancers?
So there is no one particular factor per se for kidney cancer. Like I said, see, male, increasing age group, smoking, alcohol, tobacco, obesity, hypertension, some types of chronic kidney disease like polycystic kidney disease, some types of inheritable conditions, and also occupational exposures to certain types of chemicals. And all of these things have been attributed to kidney cancer.
So, what are the symptoms of kidney cancers and how is it diagnosed?
Kidney cancer, unfortunately, it is not detected by a blood test or a urine test. See, if you take the example of prostate cancer, we have a readily available blood test called PSA test, wherein we can tell that the patient is probably having a high risk of cancer. But unfortunately, so in most situations, kidney cancer is detected when you're doing a scan for some other reason. So it may be seen in the form of an asymptomatic uh, sort of swelling seen in the scan. So, having said that, some patients do have a very big swelling, and because of this swelling, patient can have pain abdomen, especially in the flank area, or the patient may have some blood in the urine, or patient themselves may say, they're feeling some sort of mass inside the abdomen. But apart from this, patient can also have generalized weakness, weight loss, fatigue, so on and so forth.
So, do all kidney cancers behave in the same way?
No, see, kidney cancers have different histologies. So in broad, we divide it into clear cell and non-clear cell histology. And the most common type is called as clear cell, which is seen in 80 to 90% of the population, which is called as renal cell carcinoma. And in the non-clear cell subtype, we also see sarcomas. In the childhood age group, we also see something called David's tumor or nephroblastoma. So it is important for us to understand not all types of kidney cancer are the same. So there are some aggressive varieties of kidney cancer, and also there is some indolent varieties or the non-aggressive type of kidney cancers.
So, what are the stages of kidney cancers?
Interesting question. See, we need to know, it is important for us to understand what is the stage of the kidney cancer, because to prognosticate the patient and also to plan the treatment options for the patient. Okay. So when we say first stage, that means cancer is very small and confined only to the kidney. Specifically, we say it should be less than 7 centimeters in size. Suppose if it is more than 7 centimeters, we call it stage 2, but it should not spread to the nearby organs. So suppose if it has gone to the nearby organs, or glands, or the blood vessel, that time we call it stage 3. And suppose if it has gone to other parts of the body, like say bone, brain, lungs, that time we call it stage 4.
So, what are the types of treatments for the kidney cancer?
So whenever we are deciding, treatment for any cancer patient, we need to see two things. One, we need to see the patient-related factors, and second, we need to see the tumor-related factors. When we say patient-related factors, we see, how old is the patient? Is the patient having other kidney problems? Is the patient on dialysis? What is the kidney function of the patient? What is the remaining function? Is the patient having some heart problem, liver problem? What is the financial status of the patient? So all of these things we keep in mind when we're deciding treatment. So when it says, tumor-related factors, like I said, stage 1 and stage 2 are relatively early stages. So for this, I would say surgery is the treatment of choice. So when we say surgery also, it is not just one type of surgery. If it is very, very small in size, then there's something called partial nephrectomy, where we remove only a part of the kidney. Or there is something called radical nephrectomy, where the whole kidney is removed. And also, what we need to understand is the approach of the surgeon might be different. When he's performing a kidney removal surgery, it may be like an open surgery for a very big tumor, or it may be laparoscopic surgery or a keyhole type of surgery. Nowadays, we also see something called robotic surgery as well. So different surgical options are there. The role of limit radiation is a little limited. And myself being a medical oncologist, I am more concentrating on the stage 4 types of kidney cancer. Right.
So how do you treat stage 4 kidney cancer actually?
Yeah. So stage 4 means, like I said, it has already gone to other parts of the body. Okay. So stage 4, again, not all stage 4 are one and the same. Suppose if it has gone from the kidney to only one part of the body, let's say only a part of the lung is affected. So maybe still we can try to cure the patient by operating the kidney cancer, and also a part of the lung is also removed. So that is called oligometastatic disease. But in some situations where we think the cancer is a little aggressive and it is causing a lot of symptoms to the patient, then we give something called immunotherapy, and there is some newer options called targeted therapy also, which is available. So immunotherapy is generally given in the form of an injection. You're not injecting anything inside the kidney person, but you're mixing the drug inside the saline, and that is given inside the veins. It is going everywhere inside the body. So it is not just taking care of the kidney cancer per se, but it is taking care of other areas also. And the same goes with tablets as well. So tablets have been there since last 15 to 20 years, but immunotherapy, as we know, has come over the last 4 to 5 years. So I would say that is the most latest advancement when it comes to the treatment of kidney cancers.
So what steps can we take to lower chances of kidney cancer?
I think that is the most important question of the day. So all of us need to understand it. So there are some steps that is modifiable, some steps that is non-modifiable. Suppose if you have a hereditary risk of kidney cancer, obviously that we cannot change. But what is in our hand to is to at least try to lead a healthy lifestyle, have routine checks, because as I already told you, that kidney cancer is detected for a scan done for some other reason. So maybe it is a good idea for us to do routine tests and routine maybe scans, consultation with your doctors in regular intervals depending on your age, and also cutting down on maybe smoking, alcohol, maintaining an ideal weight, controlling your hypertension, and also getting in touch with your nephrologist, for example. Right? So I hope today's session was informative, and I've managed to answer most of your questions.
Yes.
And if there's anything else, I would like to take it, or I think we can wrap up.
Yeah, thank you.